Colorectal cancer, also known as colon cancer, is a type of cancer that originates from the mucous membrane of the distal section of the intestine. Various factors contribute to its development, including genetic predisposition, poor diet, unhealthy lifestyle choices, and chronic inflammatory bowel conditions. It stands as the most frequently diagnosed cancer within the gastrointestinal tract and holds a position as the third most common cancer overall. Annually, over 600,000 people are diagnosed with colorectal cancer, with a significant 67% of these diagnoses occurring in the late stages of the disease. This form of cancer is more prevalent in individuals aged 40 and above and tends to affect males more than females. While there's no way to know for sure whether colon cancer will develop, there are some early symptoms that might indicate a problem. Before we proceed, please note that everything mentioned in this video is unbiased, fact-checked, and reviewed by qualified health professionals. Now, let's delve into the 9 early signs of colon cancer that should not be overlooked. First sign: shifts in bathroom routine. Most people who develop colon cancer are around 40 years old. Indeed, half of those diagnosed are above 45, but it can also affect younger individuals. The first symptom of colon cancer often involves changes in bowel habits. Normally, a healthy colon will process waste daily or every other day, producing soft brown stools that are passed easily and blood-free. If you start experiencing changes in your bathroom frequency, or if your stool becomes hard and challenging to pass, it's important to pay attention, as these could be warning signs. 2. Diarrhea. Diarrhea, or loose bowel movements, is a common problem for people with colon cancer. The term diarrhea technically refers to the passage of 3 or more unformed stools in a 24-hour period. Diarrhea is a symptom that can also be caused by other conditions, including irritable bowel syndrome, lactose intolerance, and inflammatory bowel disease. The National Cancer Institute reports that some people may experience diarrhea because their colons are infected with bacteria or parasites. 3. Constipation. The colon plays a key role in getting rid of waste, as well as absorbing water and nutrients from our food. Sometimes it can become blocked, leading to constipation. This condition isn't just uncomfortable and potentially embarrassing, it might also be a warning sign of colon cancer. Research indicates that over 80% of individuals diagnosed with colon cancer had suffered from constipation prior to their diagnosis. Various factors, including side effects from medications or insufficient physical activity, can cause constipation. Distinguishing between ordinary constipation and signs of something more serious, like colon cancer, can be challenging. If you find yourself constipated for more than 3 days, it's wise to consult a doctor, particularly if you're also experiencing symptoms like blood in your stool or abdominal pain. 4. Blood in stool. Early detection is key with colon cancer, one of the more treatable cancers when caught early, boasting a 5-year survival rate of 95%. Still, 1 in 20 Americans will face colon cancer in their lifetime, with early detection greatly improving survival chances. Spotting blood in your stool may be an early warning of colon cancer. The colon, which holds stool before it exits the body, can be affected by various conditions that cause bloody stools, including different cancers, ulcerative colitis, diverticulitis, and hemorrhoids. This bleeding usually stems from inflammation or damage within the large intestine, but can also originate from other parts of the digestive system, like stomach ulcers. Additionally, certain medications, including antibiotics like ciprofloxacin, anti-diarrheal medications such as lactulose or iron supplements, can cause blood in the stool. 5. Rectal bleeding. While rectal bleeding can be a symptom of colon cancer, it's worth noting that the rectum, the final 5-inch segment of the large intestine where waste exits the body, often experiences bleeding for less serious reasons. In fact, rectal bleeding is relatively common and doesn't usually indicate colon cancer. Conditions such as hemorrhoids and anal fissures are frequent culprits behind this symptom. Additionally, bleeding can be triggered by a polyp or another growth in the colon, pointing to less severe issues than cancer. 6. Unexplained bloating or abdominal discomfort. Colon cancer can result from genetic factors or lifestyle choices, including diet and exercise habits, which might elevate the risk by up to 30%. Genetics are behind 10 to 15% of colon cancer cases, whereas lifestyle factors like a poor diet, obesity, smoking, and alcohol consumption could increase the risk by an additional 5% to 10%. Bloating frequently appears as a symptom of colon cancer, potentially showing up in the cancer's early stages, or as an indicator of different non-cancerous conditions. Bloating, the sensation of fullness or swelling in the abdomen often due to gas, might also stem from certain foods or medications. If you notice your abdomen swelling after meals, consider switching to smaller, more frequent meals throughout the day rather than consuming 3 large ones. This strategy not only helps manage bloating related to overeating, but can also aid in maintaining stable blood sugar levels. 7. Persistent fatigue. Symptoms of colon cancer can emerge gradually and might not initially come with obvious red flags. Feeling tired is a common experience, often attributed to lack of sleep or staying up too late. However, if you consistently feel fatigued beyond the usual and rest doesn't seem to help, it may indicate an underlying health issue. The colon's role includes eliminating waste from our bodies. If there's a hindrance or slowdown in this process, toxins can start to accumulate in the digestive system. Prolonged accumulation may contribute to the formation of cancerous tumors in the colon. Should you often feel tired and also experience symptoms like bloating or abdominal discomfort, these could be early warnings of colon cancer. 8. Unexpected weight loss. The symptoms of colon cancer can differ based on the tumor's location and its stage. Unexpected weight loss is often an early indicator of colon cancer, along with other gastrointestinal conditions. However, there are various other reasons one might experience weight loss. For older adults, for instance, it's not unusual to lose weight after recovering from an illness. But if you find yourself losing more than 10 to 15 pounds over a few months without trying, it could signal colon cancer. 9. Persistent feeling of fullness. Adopting a healthy diet is beneficial in reducing the risk of colon cancer, yet it might not be solely sufficient. Physical activity plays a crucial role in colon cancer prevention as well. If you consistently feel full, even without eating, it might indicate an issue with your digestive system. Colon cancer can lead to symptoms such as bloating, constipation, and diarrhea, complicating normal eating habits. Initially, these symptoms tend to be subtle and can easily be overlooked or misunderstood. Moreover, if you're also experiencing symptoms like unexplained weight loss or fatigue, you might attribute your digestive discomfort to other causes, potentially delaying seeking necessary medical attention. What causes colon cancer? 1. Smoking. Utilizing any tobacco products, such as chewing tobacco and e-cigarettes, raises the risk of colon cancer. 2. Excessive alcohol consumption. It's recommended that men restrict alcohol intake to 2 servings per day, whereas women should aim for no more than 1 serving daily. Even moderate alcohol use can heighten the risk of cancer. 3. Obesity. Consuming foods high in fat and calories can influence your body weight and elevate your risk for colon cancer. 4. Diet high in red and processed meats. Processed meats include items like bacon, sausages, and deli meats. It's advised to limit intake of red and processed meats to 2 servings weekly to reduce cancer risk. 5. Lack of exercise. Engaging in any form of physical activity can decrease the likelihood of developing colon cancer. How to prevent colon cancer? While it may not be possible to completely prevent colon cancer, you can significantly lower your risk by addressing certain risk factors. 1. Steer clear of tobacco. If you're a smoker seeking to quit, consult a healthcare provider for smoking cessation programs. 2. Drink alcohol in moderation. 3. Aim to maintain a healthy body weight. 4. Opt for a nutritious diet. Increase your intake of fruits and vegetables, and reduce consumption of red meat, processed foods, and foods high in fat and calories. Drinking coffee has also been associated with a lowered risk of colon cancer. You can find many interesting videos about the benefits and harms of vegetables and fruits, as well as diseases and their treatments. So please don't forget to subscribe to the channel and hit the bell icon. I would also appreciate it if you could like this video and share it with your family and friends.